If you have lumbar spinal stenosis, you're contemplating surgery, and it's not a medical emergency, then perform virtual spinal surgery on yourself first. Hi, my name is Dr. Rob Bates. I'm a chiropractor, certified athletic trainer. Over the last 38 years of practice, I've had many medical doctors coming in for spinal disc problems, spinal stenosis, and one thing that they wanted to avoid is spinal surgery because they would always say they knew exactly what happened with spinal surgery. It has poor long-term outcome. They did not want to go down that line. That's because whenever you cut, you're cutting through all that soft tissue, the muscles, the fascia, the ligaments, tendons, the disc, and sometimes the bone. And that's changing the structure permanently. So you're changing the structure, changing the biomechanics. That's creating a lot of scar tissue. And there's a condition called failed back surgery syndrome that can be as high as 74%. And then one of the most common second surgeries is going to deal with the scar tissue, and that can be up to 35% of second surgeries. So you can understand why they wanted to avoid these surgeries. So perform virtual spinal surgery on yourself first, and that's where you act as if you had that spine surgery. And you take the recommendations that your doctor would give you is take off 6 weeks and just actively rest. You avoid all those activities that you know that are irritating your spine. So you got to watch your posture as you sit, and you stand and sleep, and in the car, avoid lifting. Basically, you want to practice great spinal mechanics because you're acting like you've just undergone that major back surgery. Second thing you want to do is you want to perform exercise. You want to do 4 core isometric exercises where it's long hold isometrics of 30 seconds. You perform 3 to 5 repetitions, help stabilize and stiffen up and strengthen that spine in a real safe way that provides minimal amount of shearing force through that spine. The first exercise is abdominal curl-ups. You lie on your back, you brace your stomach like someone's hitting you in the stomach, you curl up, you hold that for 30 seconds, you repeat 3 to 5 repetitions. This is a great exercise to start off with. You want to do this as many times as you can throughout the day. This one specific exercise because it puts you more in a flex position, which means it's going to open up those little nerve canals, take pressure off the lumbar spinal stenosis, allow the nerves to desensitize and rest, the area to heal as it gets stronger. The second exercise is lateral planks. You bridge up in that lateral plank, brace abdominals, you hold that for 30 seconds, perform 3 to 5 repetitions on each side. Next is bird dogs. You get on all fours, brace abdominals, don't let that back arch. And you go into a bird dog position, you hold that 30 seconds, perform 3 to 5 repetitions on each side. Next exercise is a glute bridge. You brace abdominals, don't arch the back. You push out of your heels by lifting up your toes. You contract the glutes, you hold that for 30 seconds, perform 3 to 5 repetitions. As your body gets stronger, you perform single leg bridges. You bridge up into one leg, hold for 30 seconds, repeat 3 to 5 repetitions on each side. Perform all these exercises 1 to 4 times a day, except for the abdominal curl-ups. You want to do that as much as possible. Third thing is to strategically walk, because people that have lumbar spinal stenosis, they typically have the inability to walk or stand for long periods of time. So you want to gradually start working back in the walking. So you strategically plan your walks by planning out a place where you know there's a lot of low walls or a fence or a bench, and you walk, and once right before you start feeling the symptoms, right before the symptoms start coming up, then you go ahead and decompress off that wall or fence 15 to 30 seconds. Once the symptom starts dissipating, then you resume the walk. And right before the symptom comes up, you decompress again. And you keep doing that until you go up to your desired distance. But you want to gradually work up on this walk so the body can acclimate and adapt to more walking. And what you're going to find as the 6 weeks goes on is the body will get stronger. You won't have the pain. You'll be able to walk longer without decompressing. Know your body is healing. So performing the virtual spinal surgery on yourself is required of backing off all those daily activities that irritate your spine for 6 weeks, performing those 4 isometric core exercises of 30-second holds, 3 to 5 repetitions, and adding in the walking strategically to where you can gradually increase your walk. Now, a lot of people with lumbar spinal stenosis are also going to have a flexed hunch forward head posture position. And watch this next video that it'll go over specifically how to correct that. And if you're new to my channel, if you want more home-based spinal exercise programs, go ahead and subscribe. We really appreciate serving you. Keep spreading the word and share this information to people who really want it. We look forward to seeing you in our next video.